Thank you, Dr. Dan Jones, for talking to us today about team training. Can you tell us a bit about your work and how you got interested in this?
Well, I think the first thing to understand is what is team training, and it's just what it says. It's about a team working together to get something done. As a surgeon, what that means is making my OR work well, and working well means good communication. One of the cool things we're doing here at Harvard Hospitals and at Beth Israel Deaconess Medical Center in the Carl J. Shapiro Simulation Center is we're actually taking the two surgeons, a nurse circulator, and an anesthesiologist, and we're putting them into a mock operating room that has cameras coming down from the ceilings and microphones, and we're making things happen, oftentimes quite stressful. It could be uncontrollable bleeding, it could be a sudden cardiac arrest or a breathing problem, and we're seeing how that team, the same team that they would be in real life in the OR, now in this other setting, are dealing with it. And we're recording it and going over it and providing feedback. And so part of team training is, are they using checklists? Are they using closed loop communication where the leader says, hey, can you do this? And the responder says, yes, I can do that. Are we breaking down barriers so that the junior people in the room, the medical student and the scrub techs, can say, hey, I think this is a problem, and be able to speak up? They may be the first ones to identify it. So this is a very fascinating area in surgery. It's called OR team training. It's actually sponsored by our malpractice carrier in the Harvard hospitals. I think this is a way we're going to move. If you think about it, it's not any different than the football players practicing before a game, a scrimmage, or the Delta Force working out a mission before they go into a foreign land. But now we're saying, hey, surgical teams can do the same thing. If we're prepared, we know how to respond in a crisis, we're going to do a better job.
Yeah, I was going to ask about the same concept in other industries, and I suspect other teams where they're trying this in medicine as well, besides the operating room. Is there literature about the effect of the team training in other industries or in medicine yet?
Well, again, team training can be in multiple teams. So it can be the ICU team talking about delivery of bad news. It could be the trauma bay where everyone has their own job in terms of putting in lines, intubating, getting someone ready after a major car accident or a gunshot wound. And sure, other industries, medicine, military, folks, aerospace, everyone who practices with the idea of doing better gets better usually. Now, what's the literature and data for the OR? It's really hard to prove. What you really want to find out is, if you do this training, does it make a difference in the OR? And intuitively, the answer is yes. Proving that scientifically is hard.
Sure.
But we have plenty of anecdotal cases. A couple years ago, one of our nurses did one of our team trainings with us, and afterwards she said, you know what, I'm an OR nurse. I almost never have to pull out a defibrillator and use it. In fact, I haven't had to do it in 25 years. So we simply said, well, do you want to take 5 minutes, learn how to do that just for fun? And she did, and 2 weeks later she wrote us back and said, I was the first one to respond to a code. I knew how to put the defibrillator on. I saved a life. I would have never believed it.
Outstanding.
Or I can think of another example where we had 2 interns in July, and the fellow brought them into the simulation lab and tried to run through some trauma scenarios. And unfortunately, these interns just kept killing the mannequin over and over again. The fellow was obviously distraught that we had these guys who were just going to kill mannequins, they might kill people. But again, about a week later, they encountered one of the same scenarios, did everything perfectly, saved a life, directly related to having practiced this a couple weeks before. So especially with rare events, especially where things involve communication, especially when things are stressful, the idea of practicing these things in a safe environment, sometimes several times, so that when you experience it for real, you're able to do your best, it can make all the difference.
Yeah, sure. Have you found some challenges in introducing this new form of education into the old model? And logistically, it would seem to be hard to get all these people in the same place and the resources.
Yeah, I mean, there's a lot of challenges. I mean, the biggest challenge is work hours. The government has come in and said, trainees can only work 80 hours a week, which for a surgeon is not very much. So the idea is you're going to take them out of the OR setting or out real for patient care in order to go to the simulation center. So one is hours. 2 is logistics. It requires quite a number of people to put on these events and make them meaningful.
Yeah.
But, I think more and more we have a commitment to it. We know that with the shorter work hour week, we need to have very deliberate practice. It can't just be what happened to come in through the ER or what happened to be on the OR schedule. We need to make sure that our trainees see the things they need to see, have a chance to reflect and progress in what would be a quite logical pattern.
Sure. And who else is doing similar work? Are there other
Sure. Right now, in terms of team training, all the Harvard hospitals have this for their groups of faculty, the surgeons, anesthesiologists, nurses. So we're rotating through people at each of our Harvard hospitals. In terms of nationally, there's curriculums that now are established for medical students, which include simulation and team training. And there's curriculums established for residents, which also include group activities and team training. So it's out there, and I think we're going to see more and more of it.
Growing trend. Excellent.
Yeah.
Thanks very much for talking to us today. Appreciate you taking the time.
Nice talking to you. Bye-bye.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.